Hey guys, Dr. Amir Nafi here. Today, what we're going to be doing is looking at a patient of mine that I am currently doing some planning for 8 implants, 3 on the lower, 5 on the upper, and wanted to take you through my implant planning software that I devised with my lab technician, and I will be taking you through the whole process and some challenges that we foresee, but also with some solutions that we've devised. All right, so here's just a quick overview of the lower arch. As you can see here, we have tooth number 18 and 19 and tooth number 31 that are being planned. Here you can see that we ensured that the angulation of the implants are ideal, and as you can see, as we scroll through here, we can see that we are very far away from the inferior alveolar nerve, and so we're kind of in a safe zone there. Here you can see that the sleeves for the surgical stent here are in place, and that gives an idea of the emergence of where the crown is going to be and the access. Here we're just doing some measurements to show how far the implants are away from each other, and then how far implant number 19 is away from tooth number 20. You can see we're just scrolling through the bone here, just ensuring that, again, we're in our safe zones and we have plenty of bone on the buccal and the lingual. So now we're swinging over to tooth number 31. Here you can see the angulation is good. Also, it shows here that there's kind of like an outline of where the crown is going to be, and also where the bite forces are going to be applied from the opposing tooth. Really, there isn't too much to worry about for the lower arch. It's pretty straightforward, plenty of bone. The planning on that was pretty straightforward. And then as you'll see with the upper arch, there are a little bit more complications just due to the density of the bone and the recent extraction of number 3, and the availability of bone and also the sinus membrane, and I'll walk you through that as well. So right now we're going to be going over the upper arch, in which we are placing 2 implants on the upper right in areas number 3 and 4, and then we're going to be placing implants in the area of number 12, 13, and 14. And I will be going through some of the potential challenges during this surgery, as you will see the current healing of tooth number 3, and that might pose some potential challenges due to the density of the bone and where the sinus is. So as you can see here, we start with both arches. Then we isolate the upper arch here during our planning, and then you can see where the access is for each implant. You can see what the potential crowns look like. And as we are starting here, again, we discussed number 3 earlier. And as you can see here, where the sinus is, I'm going to pause this screen recording here. So as you can see right here, the sinus membrane, so from the bone that we have to the sinus membrane, is about 3 millimeters. Now, 2 directions I can take this. I can, place the implant and, see if I can get some primary stability with the 3 millimeters, which it's not likely. Usually you want about 5 millimeters minimum. And what I can potentially do is place it in the 3 millimeters, pack some bone around it, and see if we get some osteointegration there with the bone. Or, and this is probably more ideal, is we do a little sinus lift there, get a few millimeters of bone, and then let the patient heal, and then bring them back, finish out that implant. But those are the 2 directions that I would go for number 3. As you can see, the crowns are outlined there to see where they would be, and then I have plenty of room from the anticipated implant to number 2, tooth number 2, and then from implant to implant, obviously you need a minimum of 3 millimeters. And here you can see we have 4. I'm just taking you through the bone here. See, we have plenty in the area of number 4, implanted tooth. Just walking you through the bone. Patient has plenty of bone on this side. Taking the implant right to the sinus. Just doing some measurements here, 3 millimeters, perfect. And then you can see the outlines of the crowns, the anticipated crowns that are coming. Nice bone here. We're gonna be placing some nice thick implants. So we have plenty of room from 15 to implant number 14. With careful implant planning, I am confident in a successful outcome of this procedure. Thanks for tuning in, and stay tuned for more insight on implant procedures and for the completion of this case.